Hey everybody, Luke Gordon here, and I'm back with another video about Alzheimer's disease and how you can reverse the process of Alzheimer's disease and improve cognition and memory. And so again, I'm just kind of going through this book by Dr. Heather Sandison called Reversing Alzheimer's, and there's just a ton of good information in here, so I just kind of want to give you the highlights and kind of the take-home points as well. So this is the fourth video in this series, and we're going to talk about the 8 aspects of what she calls the toolkit. So these are 8 areas you can focus on to help, again, reverse Alzheimer's disease and improve cognitive function and memory. Lost my page here, so sorry. Here we go. And I will say this too. I mean, having a list of 8 things is helpful, but it can also feel very overwhelming. So as I'm going through the content, think of a couple different things. The first thing you can think of is there might be some areas that are easy for you to just kind of pick off and get some momentum. So think of those first if you're just looking for like a quick win. And then the other one you can think of is where's the biggest impact, the biggest kind of return on your investment of time and energy. So think of that. My intent here is not to overwhelm you, but give you lots of information, and then we'll give you some little tips as we go along too. She also lays out one tip for each of these 8 areas. And then in future videos, I'm going to talk to you about how you can kind of combine multiple things at once to make everything much more digestible and easy to follow. So again, trying to get too overwhelmed as I go through these 8 things. So the 8 things that she has, I'll just kind of go rapid fire first, and then I'll give you some tips. Diet is number 1. Exercise is number 2. Activities, number 3. Routine, number 4. Environment is number 5. Sleep is number 6. I don't have enough fingers for that one. Communication is number 7. And, excuse the truck there, care for the caregiver is number 8. So those are what she figures are like your 8 areas that you will focus on with the entire Alzheimer's toolkit. And so if we go through these a little bit more in depth, let's look at the first one, which is diet. And specifically for diet, what she recommends, which is pretty well backed up by the research, is a ketogenic diet. So that's a really high fat diet where your body, it's a nice look, is burning ketones instead of burning glucose for energy. So she goes into that. There's some really interesting research that if you can get into ketosis safely, that you can have almost an immediate improvement in cognitive function and memory. And she says if you do only one thing to improve your diet, hopefully you've already started raising your carb consciousness and begun to swap out some of the carb-heavy foods with lower carb alternatives. So I mentioned this in a previous video. Won't go into it in super detail now. But she recommends for ketosis that you get under 100 grams of carbohydrates a day. And again, if you're looking to do this, obviously work with your medical practitioner or someone like a nutritionist who can help you kind of manage it, because it's a tricky one. Okay, so that was the first thing. The second one is exercise. Exercise is so good for your brain. So she goes into all of the research on how that helps. If you do only one thing, she says, for exercise, change up your current exercise routine in a way that challenges your brain and amps up your intensity. So if you're just used to doing some type of kind of low resistance exercise or low intensity, mix it up, vary it, because if you challenge your brain with different levels of intensity or just difficulty, that's going to be really good for your brain. So that was number 2. That's exercise. Number 3 then is environment, right? Is that where we're at? Sorry. Nope, it's activities. Where did we go? Sorry. Okay, yes. So fun activities, new activities, that's going to challenge your brain and force it to keep firing those synapses. It's going to improve brain health overall. So she says if you do only one thing with activities, if you're in prevention mode, use this as your motivation to start learning a new hobby or skill. And if you are more like in treatment mode or trying to reverse Alzheimer's mode, it could be just relearning something that you used to know, like a card game or an activity, or reading a book that you used to like to study about. So that's activities. Number 4, I think, is stress. Sorry, I should have taken some better notes here. Number 4 is routine. So creating a better routine will help you reduce stress, specifically if you can create some consistent routines around your morning and your evening routines. I'm going to talk about that in the next video actually, so I won't go into a ton of detail here. But she says if you do one thing for routine, pick one aspect of your day to routinize. It could be your morning, lunch break, or evening, and just make a routine for that specific part of your day. So start small there. All right, next up, number 5 is environment. So she says basically, if you can declutter your environment and make your space just easier, less stimulating, that can have a really positive impact on your brain. So just kind of decluttering, making your environment a little bit easier. And then she also says bringing in some more natural elements. If you do one thing, she says declutter as many areas around your house and your day-to-day living space as possible. Okay, next up, I think we're on number 6 now, is restorative sleep. This is one that can't be overstated in any aspect of health, but brain health particularly, because so many important things happen in your brain overnight when you sleep. So she says if you do one thing to improve your sleep, put a bubble around the 3 hours before you go to bed. So during these 3 hours of your day, don't eat, minimize screen time. Whatever you're watching, don't make it too stimulating. Try not to exercise too intensely. So you'll hear a lot about, again, just having a better sleep rhythm and routine. I think I'll link a video here. I made this about some other sleep tips that you probably haven't heard of yet. So check that one out too. There's a lot. If you can improve your sleep, you are doing really good things for your brain. Okay, sleep. Communication, I think, was the next one, and she basically is saying prioritize connection. This is more about you and your caregiver, or if you are the caregiver, so to prioritize connection over correction. She says if you do one thing to improve your communication, adopt the improv principle of yes and, meaning that if your partner is having a hard time remembering something, it doesn't make sense, don't challenge them, don't reject what they're saying, don't try to argue with them. Just kind of flip your strategy around there a little bit. I'll leave it more to the book to explain that if you want. That's not a great explanation, but yeah, try as much as you can not to get agitated or to really try to argue or confront your person who is having cognitive decline, because it doesn't help. Doesn't help you or them. And then lastly is care for the caregiver. So if you are the caregiver, it can be extremely stressful for you having to help someone that you care about with these issues, with Alzheimer's and cognitive decline and memory issues and things like that. So she's got this whole thing about basically taking care of yourself if you are that person. And this is super important because if you are the caregiver, you are much more likely to get Alzheimer's yourself. So it's really important there. If you do one thing, enlist someone to help you. Even if it's just one day a week, get some help and give yourself some time off so that you can prioritize your own health. So those are the 8 aspects of what she calls her toolkit for Alzheimer's. Next up, I'm going to make another video on the most important things that you can focus on to really make the toolkit work and prioritize it. So hope these videos are helping. If you have any comments to make or things that have worked for you with Alzheimer's disease and brain health in general, please feel free to leave it below the video. And otherwise, keep watching for more. Thank you.